I'm sure you see those patients that, hey, I pee fine. But then you go in and the true story, I mean, they have severe trabeculations, even though the PVR is low, but still, you have a big prostate, 60, 80 grams, kissing lobes. But they say, but I pee fine. Why am I going to do a surgery? So then that UroCough will give you the information or the transition to, hey, we need to do something before that bladder goes to stage 5. So Wayne, can you go over the 5 stages of function or bladder damage?
Yeah, so the 5 stages of bladder health, that's really fun. Yeah, for folks who want to learn more, feel free to go to manversusprostate.com. It's a free download, as well as the Italian Brigade of Defenders of the Diffuser, led by Defender Luca Sindolo. He really picked up on this and really has put his academic wisdom on the 5 stages of bladder health. And you can get that in the Journal of Nature of Prostate Cancer and Prostatic Diseases. And that's with that, go to manversusprostate.com. Really insightful comments from him from a very nicely academic perspective. And the 5 stages of the bladder health, amazingly, has really taken off, at least on LinkedIn, and to the point it's been inspirational for urologists around the world. So there's Defender Sonny Schlein of Schlein Catheters and Prostolon. He actually did a painting, if you get a chance to see it. I mean, it's amazing. I couldn't believe it.
No, I saw your post of the catheter, but no, I haven't seen the painting.
I'll have to put that back out again, but it's got the saintly bladder being attacked by these 5 demons, representing the 5 stages of bladder health. And we have to recognize the bladder is being victimized by the villainous prostate, as that prostate's getting bigger and growing tighter. And the 5 stages of bladder health, as I said, is really the talk track that allows us to guide patients to make the best decision, as well as to pierce the armor of masculinity that allows them to lower their defenses and to reach for something greater for themselves, which is a life well-lived, catheter-free and chemical-free. And so it's a verbal map that we talked about. And the reason why, if we're going to talk about, take for example, cancer, we talk about late-stage prostate cancer. Nobody wants that. Same thing with BPH. And we talk about prostate cancer affecting 1 in 8 men. Well, we should be at least as concerned about BPH, which is affecting 8 to 9 of 10 men and preventing late-stage BPH. But to say that, we need to have the stages. And so the 5 stages are predicated on the fact that it has to have relatable terms, right? So we're talking about the prostate as the size of a golf ball and the shape of a mini donut. We express a sense of gravity that, the bladder is only 1 of 2 organs that cannot be transplanted, the brain and the bladder. We've reinforced that, hey, Mr. Smith, this is a problem when the IPSS score is 8 and above. And then we need to make an analogy where people can relate to. As you and I know, really the perfect correlate for the heart is valvular heart disease or aortic stenosis. But if we got into valvular heart disease with our patients, we'd never get out of that room. Luckily, we have ischemic heart disease, and people can understand that. And so as a result, I created the 5 stages of bladder health. So as that prostate's getting bigger, right, the donut hole's getting tighter. And Mr. Smith, we talked about the heart's a muscle that pumps blood. The bladder's a muscle that pumps urine through that prostate. So as that donut hole gets tighter, stage 1, things are going to slow down. And then stage 2, if we don't take care of that problem, the bladder now over 5 years, 10 years, 15, 20 years is going to be overworking, struggling, quivering, becoming overactive, causing those symptoms, Mr. Smith, of urgency, frequency, getting up in the middle of the night. And then stage 3, I think, is one of the most important. Mr. Smith, if you don't take care of this, your bladder will start to act out like a rebellious child and squeeze without your permission, cause you to leak down your leg. Why is that important? Well, because it's not even covered. Urge urinary incontinence is not covered in the IPSS. And I will say, at least from my experience, and Jose, you may or may not feel the same, but that's the most embarrassing and shameful. I've had guys who stopped leaving the house because they were leaking down and smelling funny and embarrassed to be in the shopping mall. And then stage 4, Mr. Smith, just like the heart can have a heart attack, the bladder can all of a sudden stop working. You show up in the emergency room needing a catheter. And in stage 5, just like your heart can go into heart failure, your bladder can go into bladder failure. And you may need a catheter for the rest of your life. And the one difference is, Mr. Smith, is if your heart went into heart failure, you can still get a heart transplant. With the bladder, that's it. Game over. You're living with that situation, and that's not okay. And so that story, that verbal roadmap that we're guiding them down, activates them to make the best decisions for themselves. I'm not telling them what to do, but they're self-activating. to take action about their situation because they don't want to be that guy that gets late stage BPH. They don't want to be that guy that was warned about it and chose to do nothing and then ended up with a dead bladder. And it's the fear of catheters, the fear of emergency room visits, retention, wreaking on themselves, and that vision, that dream for themselves to live their best lives, the best version of themselves, chemical-free and catheter-free, that is going to have them want you to get the data to find out what's going on.